Okay, we are going to use these learning objectives. At the end of this session, participants should be able to recognize the role of customer satisfaction in a quality management system. We all know that the lab is a service delivery entity of which the customers receive the services. It means that customer service is the reason the lab exists. Customer service is one of the 12 quality system essentials. And you may ask, what is the relationship between quality system essential and quality management system? Quality management system is like a building. And what makes up a building are building blocks. So quality system essentials are the building blocks of a quality management system. And if you look at this, you see that customer service is one of the building blocks of quality management system. And customer service is one of the 12 quality system essentials that make up a quality management system. The future of the lab is defined by how well your customers are satisfied with your services. So the question I want to ask is, how well do you want to serve your customers? In the course of the presentation, we also hope to explore methods for providing clear and relevant information to laboratory clients. In the course of the presentation, we will see who the laboratory customers are. At times, you are doing your best, but the customer is not satisfied. The customer just has wrong perceptions of you. This may be due to a gap in communication. For instance, the physician sends samples to you for liver function tests, and he writes urgent on the request form. He doesn't understand that you pack your samples to run them maybe once in a day. When there is clear and timely communication between the lab and our customers, it helps to build trust and enhance patient care. In the course of the presentation, we also understand the various methods for gathering customer feedback. It is said that any complaint you get about your lab services is just the tip of the iceberg. So we must be intentional in getting customer feedback about our lab services. We also develop skills to handle customer complaints with empathy and professionalism, then enhance stakeholder engagement in the lab. Because if you don't get top management engaged in the lab, your aim to enhance your quality may meet a big end. Okay. I don't know if this survey is on. So these are the poll questions. I suspect that it is going on now. So I will not want to answer them. We have question 1, question 2, question 3. So yes, I can see the poll has come up now. So you answer them. We'll just give you a few seconds.
Some time for us to respond to it.
Okay.
Yeah.
So take your time and answer the poll. Hello.
I believe you can proceed now.
Okay, thank you very much. Okay, so essentials of an effective customer service program in the lab. International standards such as ISO 15189 2022 document, which concerns the medical laboratories, emphasizes customer satisfaction as a measure of laboratory quality. You know that traditional businesses, they have a physical product that they sell. But in the lab, the product we sell is the test results. And the funny thing is that every lab produces results. There is no lab you enter and they will tell you, sorry, we can't produce results. But if you do, let's say, liver function test in 2 different labs, and you get 2 different results, what will make you trust one and not the other? Ensuring high-quality customer service strengthens trust and reliability in laboratory results. And there is this thing that is called changing customer expectations due to comparative experience. There's something that happened in my last location that illustrates this very well. It was a supermarket. It was the biggest in the state capital. It was so big that the governor's wife used to shop there. Then one day, another supermarket opened across the road, directly opposite it. This new supermarket opened with a bang. As you are entering it, you see at the door, lowest prices you can trust. Then the automatic door opens for you. Once you enter, everywhere was air conditioned. You had labels showing you this is a section for household items, this is a section for frozen foods, drinks, beverages. When you are done and you go to the pay point, you see friendly cashiers using barcode machines, ping, 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 and they are taking your prices and you're making your payment. In one day, all the customers moved from the first supermarket to the second supermarket. And then out of curiosity, maybe you didn't find something in the second supermarket and you go to the previous supermarket, you now see all their flaws become very obvious to you. You see the dusty shelves, the hot environment, and many other flaws, which were not obvious to you before. But you have now tested something new, and then the flaws of the first is now exposed. That illustration can also be an experience for a lab. A customer who was previously satisfied may become dissatisfied, not because your lab's quality declined, but because they've experienced better services elsewhere. They've gone to a lab. When they come to your own lab, you tell them error function test takes 2 weeks. Then they go to a new lab. They tell them 3 days, come for your results. You have frontline customers that have bad attitude, and they go to a new lab, and they have friendly frontline staff who answer all their questions. They have a new lab that sends results to them by emails. They have a new lab that is clean and has a welcoming environment. If your lab does not meet this new benchmark, the same service that once satisfied the customer now feels inadequate. This underscores the need for continuous improvement and benchmarking. So you have to meet customer expectations and exceed them if you want to stay relevant. Quality in the clinical laboratory, meeting customer requirements. Philip Crosby, a renowned quality expert, emphasized that quality is meeting customer requirements. While his principles were initially applied in business and manufacturing, they are equally important in medical lab. A laboratory must identify its customers and determine their expectations and requirements. Types of customers. Who are the customers we have in medical lab? The first, we have healthcare providers, the clinical customers. They are the primary users of the lab. They need the results to make diagnosis, treat, and monitor their treatments. Examples of clinical customers, we have the physicians, general practitioners, specialists, surgeons, nurses, dentists, midwives, physiotherapists, many of them dietitians, clinical psychologists. These physicians, they rely on your lab data for clinical decision making. And then the next set of customers are the patients. They are the end users of your lab results. So the patients could be inpatients, they could be outpatients, walk-in patients, those that come for health screening, for certificate of medical fitness, they are the patients. And what do they expect? They expect accurate, timely, and reliable test results to guide their treatment. Then the next set of laboratory customers are the administrative and regulatory bodies. You may be asking, why administrative and regulatory bodies? Why are they laboratory customers? Yes, it is said that the customer is king. A lab where the healthcare providers don't send requests to will be out of business. A lab that doesn't have patients will also be out of business. And there are regulations and standards set by the Nigerian government to guide lab operations. enforcement of compliance to these standards is domiciled with the Ministry of Health. If the Ministry of Health finds you in breach of these standards, they can close your laboratory. So you also have the councils, the different councils, NDCN, Laboratory Science Council, accreditation bodies, etc. They are all part of the administrative and regulatory bodies that make up, that form part of your laboratory customers. You also have health maintenance organizations. You know that many labs now have majority of their patients that come through HMOs. So HMOs are part of the administrative and regulatory bodies. Then the fourth category of laboratory customers, we have public health and community stakeholders. Public health agencies, they use lab reports for disease surveillance and public outbreak investigations. We have the Nigerian Center for Disease Control, responsible for disease surveillance and outbreak investigations. We saw how helpful they were during COVID-19. NACA, National Agency for the Control of AIDS, epidemiologists, they are part of the public health professionals that are also laboratory customers. Then you have the community hosting the laboratory. They are also laboratory customers. Okay, we now look at the roles and responsibilities in ensuring customer satisfaction. The laboratory director, the buck stops at his table. He has the responsibility of ensuring customers' needs are met. He ensures a culture of quality and customer focus is established and maintained. Then the quality manager has responsibilities of objectively measuring customer satisfaction. So it's not just, oh, customers are happy or customers are not happy. It has to be measured objectively. And that responsibility is domiciled with the quality manager. He may do that through surveys in which he gets direct feedback from laboratory customers. He may do that through indicators in which he tracks trends in complaints, service delays, or other parameters. Or he may do audits where the processes are evaluated, issues are identified, preventive and corrective actions are implemented to ensure continuous improvement. Everyone working in the lab must recognize the importance of customer satisfaction and contribute towards it. They must interact with customers professionally, courteously, and informatively. The key requirements for seeking customer satisfaction. For you to effectively seek and ensure customer satisfaction, managers of the lab must focus on four key requirements. Four key requirements. There must be commitment, there must be planning, they must be knowledgeable, and resources. They must have the resources. So commitment, we know that many laboratory management prioritize technical competence, sometimes overlooking customer satisfaction. All they are concerned is, oh, do you have your annual practicing license? Do you have your full registration? So once you have that, you are technically competent. But they don't try to inquire if the person has other soft skills like communication skills. Does the person have a smile on the face? Is he empathic? Is he courteous? Is he kind? Is he someone that is easily irritated? So these ones, they don't care about this. And these are the things that affect customer satisfaction. So at the end of this presentation, we hope that you should be able to recognize these soft skills and demand them from your staff. So these are things that they need to be emphasized so that every lab worker integrates customer satisfaction into daily practice. Then the next is planning. Effective monitoring of customer satisfaction requires proper planning. It is said that if you fail to plan, you have planned to fail. Laboratories must develop appropriate tools before gathering data on customer satisfaction. We are going to see these tools later on in this presentation. Another key requirement for seeking customer satisfaction is knowledge. The laboratory should consider training staff in customer satisfaction assessments. If they don't have the requisite skills in-house, they can consult experts from outside. And then fourthly, the fourth key required for seeking customer satisfaction is resources. Customer satisfaction monitoring, it does not have to be expensive. What you just need is to give it time. Once you have a laptop, you have the relevant software that can do some data analysis, you are good to go. Okay, so let's answer this question. You can put the answer on the chat box. Once I get any correct answer, then I'll proceed. The question is, a patient lodges a formal complaint about poor service at a clinical laboratory, citing unprofessional behavior from the front desk staff and a phlebotomist who failed to explain the blood collection procedure. According to the ISO 15189 standards on leadership, personal competence, customer focus, and complaint handling, who holds ultimate and shared responsibility for ensuring customer satisfaction in this scenario? A, only the laboratory director, as they are the head of the laboratory and legally accountable. B, only the phlebotomists and receptionists, since they interacted directly with the patient. C, everyone in the lab, including top management, technical staff, and support personnel, as customer satisfaction is a shared organizational responsibility. D, only the quality assurance team, since they are specifically responsible for quality management and customer complaints. You can put the answer on the chat box. I'm looking at it. Okay, I've seen an answer that's yes. The correct answer is C. So correct answer is C, because customer satisfaction is not the job of a single individual. Everyone is responsible. Thank you very much. Thank you very much. Okay, we'll continue. So we now start taking them one by one. How do we meet healthcare provider expectations? Healthcare providers, we have seen the people that make up healthcare providers. They have expectations. What are the expectations from the lab? Healthcare providers rely on timely and accurate results to manage patients effectively. Laboratories must ensure quality in pre-examination, examination, and post-examination phases. At the pre-examination phase, physicians, they require a well-organized test menu to easily choose appropriate tests. You know, there are some request forms you see everywhere, it's just clustered. Requisition forms should be clear and user-friendly. They include mandatory fields that they need to fill, maybe to put in the clinical details, and then use checkboxes for test selection. It makes it easy. Just select, check the test you want to do. Instead of writing serum electrolytes, some will write AUCR, some will write creatinine. No, just make it easy. So just check and then continue. Sometimes samples are collected from patients in the ward, A and E. The laboratory should provide the clinicians with standardized specimen collection procedure. This laboratory handbook, or whatever you call it, should indicate the right sample bottles for each test and how to transport them to the lab. You just think that it's common knowledge that everyone should just know that if you want to do electrolyte creatinine, that you should use lithium heparin, or you want to do this MBBS, you should use EDTA. It's not everyone that knows that. It's not everyone that knows. So someone might want to do electrolyte creatinine, and he puts a sample in EDTA bottle. So there should be a handbook that is easily accessible to healthcare providers. It might be in the ward, the A&E, waiting areas in the lab, different places. If you are so advanced, it can even be at your website, so that when they want to collect samples, they know the right sample bottles to use and how to transport. There are some samples that when you are transporting, you don't expose them to sunlight. So you indicate them briefly in the laboratory handbook. These are the things that physicians expect from the lab. Then at the examination phase, the healthcare providers, they expect testing personnel to be well-trained and competent in performing laboratory tests. They don't want to get discrepant results. Maybe the lab does a test and gives one result. The question is, and they try it in the, outside the lab in town, and then they get something different. Physicians don't want that. They want to get accurate results the first time. The laboratory should ensure that quality control procedures are supervised to manage errors effectively and ensure accuracy. They should also conduct regular competency assessments. You might get somebody that is technically competent. Is the minimum number of hours that constitutes fasting. So these are the information that they need to be aware of. With the results, when you do the test, with the results, will you send directly to the doctor or not? The sample collection area in the lab should be clean, accessible, and patient-friendly environment. They also want their confidentiality maintained. So if you look at this, you see this is a ISO 15189-2022 document plus 4.3. If you open it, you see that it has requirements regarding patients. If you read through it, you see some of the things they emphasize is that some of the things that we frequently discuss in this presentation, that the requisition form should have space for clinical details of the patient. For instance, a patient for thyroid function test, the clinician should state whether there is a weight gain or loss, the medication they are using, because that will aid result interpretation. They also want the lab displaying patient guides in waiting areas or hospital websites that explain how samples are collected, what to expect during testing, when results will be ready, test cost for those that are paying out of pocket. The standard doesn't want obsolete tests on request forms. When you pick some of our forms, you see many tests that the lab doesn't offer, occupying space on the requisition form. It recommends quarterly review of examinations offered by a lab, and it can be done through a laboratory clinical interface to remove obsolete tests or add new ones based on updated guidelines. For instance, if your facility wants to discontinue running erythrocyte sedimentation rate, ESR, in favor of C-reactive protein, you don't need to leave both ESR and C-reactive protein. If you don't want to do ESR again, remove it from your lab form and then leave only C-reactive proteins. So this clause also recommends phlebotomy staff trained to treat all patients courteously, ensure privacy during sample collection, and minimize discomfort. It shouldn't be a situation where the phlebotomist is asking the patient, you want to do HIV test? And other patients are overhearing such discussions. It's not appropriate. Obtaining informed consent when doing some investigations. You want to do a bone marrow aspiration, written consent is necessary for some investigations. If you want the patient to take part in the research, then there should be informed consent. But there is not every investigation that needs informed written consent, because there are some tests you want somebody to do maybe fasting blood glucose, and then it comes. Once the person comes with a form and pays, that payment shows consent, pays, presents to the lab. So those ones don't need their consent. But if you want to do specialized investigation like bone marrow aspiration, other investigations, those ones need written consent. So this, if you check the clause, it specifies the requirements regarding patient's expectations. Okay, then this page just shows you the patient and patient provider requirements at a glance, so we'll not waste time there. Okay, take time. Answer this one, question 5. You put the answer on the chat box, then we'll continue. A patient who frequently visits a clinical lab for blood tests raises concerns about excessive waiting times and inadequate privacy during sample collection. In line with ISO 15189 requirements on user feedback, patient rights, environmental conditions, and continual improvement, what is the most appropriate and compliant action the laboratory should take? A, apologize to the patient and explain that delays and privacy limitations are common challenges in healthcare settings. Introduce a queue management system, enhance waiting room comfort, and modify the collection area to ensure privacy and dignity during sample collection. Prioritize speed over safety protocols in sample collection to reduce waiting time and appease dissatisfied patients. Focus solely on analytical accuracy, disregarding patient comfort as technical quality is the primary goal of laboratory services. Okay, beautiful. I'm seeing the answers they are coming, and many of them are correct. Yes, option B, that is the correct answer because it addresses both wait time and privacy concerns. Okay, so we have seen some of the health provider expectations and patient expectations. Then we'll now look at the administrative and regulatory bodies expectations from the lab. Administrative bodies and regulatory bodies like the Ministry of Health, the various councils, accreditation bodies, HMOs, they have their own expectations. The Ministry of Health and related parastatals, they use lab-generated data for public health surveillance. You remember how COVID-19 tests were aggregated across the country for response planning. They use this data for public health surveillance, outbreak detection, and disease trend monitoring. Now, we have cholera outbreak in Lagos. So the diagnosis being made in the labs, they are being collected by and there is Lassa fever and monkeypox outbreak. So the number, once there is outbreak of such, the information is aggregated and then submitted to these relevant parastatals. You have professional councils, MBCN. They also have the expectations from the lab. What they do, they are mandated to monitor laboratory compliance with regulations, including proper documentation of errors and turnaround time, evaluation of personnel competence and practice standards, supported by lab performance in internal audits, etc. Accreditation bodies like ISO 1519, NINAS, Nigerian National Accreditation, NINAS. So all these ones, they equally have expectations. Assessment of laboratory quality management systems, including participation in proficiency testing and continuous improvement actions. They verify the data integrity and your documentations during site inspections and audits. The HMOs, they use lab results to validate medical claims and authorize treatments. So they expect accurate results from you. For instance, they want to check the HbA1c results before they allow patients to commence insulin therapy. So they have expectations. They review test utilization patterns to detect overuse, fraud, or inappropriate billing. Then the public health and community expectations. The public health and community expectations. Epidemiologists that work with the NCDC, they require timely and accurate lab-confirmed data to support outbreak detection and trend analysis. They require your cooperation with standardized sample collection protocols and case definition during epidemics. Public health physicians, they expect reliable test results when they conduct mass screening programs. For instance, they want to do screening for hepatitis, sickle cell, maternal infections. They expect reliable test results from us. Environmental health officers, they expect proper waste segregation, treatment and disposal in compliance with environmental health standards, safe handling and containment of biological hazards that may pose a community risk. You have field surveillance officers, they are deployed under programs like the Integrated Disease Surveillance and Response to collect and report disease data. Prompt communication of notifiable disease like cholera, Lassa fever for immediate field response. You have infection prevention and control specialists. They want you to adhere to biosafety and decontamination protocols to prevent healthcare associated infections. You have program managers, coordinators, those that work with WHO, UNICEF, the NGOs that work with USAID, PEPFAR. They need your support for program-specific testing, such as HIV, TB, malaria vaccination campaigns. So timely and complete data reporting to them is important so that they can pass the information to their donors before, so that they can their money for the next quarter. Then the community expectations. The laboratory must ensure safe containment of hazardous materials and protect workers and visitors. Proper waste disposal and transportation of hazardous materials are essential for environmental safety. Okay, so meeting all these expectations of customers that we have seen is not optional. It is a core responsibility of a well-functioning quality management system. A laboratory that prioritizes customer service builds a professional reputation. Okay, let's see how much you've assimilated from what you've seen so far. This is the next question. You put your answer on the chat box so that we can continue. The question is, during an outbreak of highly contagious disease, a public health official often contacts the clinical lab for test results and guidance on proper specimen collection procedure. According to ISO 15189 requirements regarding user communication, confidentiality, public health responsibility, and emergency preparedness, what is the laboratory's primary and compliant responsibility in this scenario? A, provide test results only to the requesting physician in accordance with standard procedures and decline communication with public health officials to avoid legal exposure. Share identifiable patient information with the public to increase awareness of the outbreak and support community response. Collaborate with public health authorities by providing timely, accurate test results and clear standardized sample collection guidelines, while ensuring compliance with patient confidentiality protocols. Refuse to process or report or outbreak-related cases since they do not originate from private paying clients and may strain laboratory capacity. Okay. Okay, yes, you can see the answers. Okay, yes. Many of the answers are correct. Correct answer is C. Because in this C, there's active collaboration with public health authorities, there's timely communication of results, provision of guidance, strict adherence to patient confidentiality. Okay, so we have seen the expectations of different customers, and we have seen that they need to be satisfied. So what are the tools that we need for monitoring customer satisfaction? We've seen that if you don't satisfy your customers, you will not continue in business. So satisfying them is very, very important. So what are the tools? And this satisfaction, we say that's something that has to be done objectively. So what are the tools that we need to do that? To ensure customer needs are met, the laboratory must proactively seek feedback rather than waiting for complaints. So you don't need to wait for complaints. You go seeking feedback from your customers. There are multiple monitoring tools needed for a comprehensive assessment of customer satisfaction. To monitor complaints, the laboratory can have a suggestion box at the reception area. As customers leave, the security man can remind them to make suggestions and drop in the box. There should be a pen, sheet of paper there, and hand sanitizer, so they can quickly make and drop it in the suggestion box. Then you now review them. Many will not comply, but the few that will respond will go a long way in helping the lab satisfy our customers. You can also use quality indicators. You measure parameters objectively. Indicators like the turnaround time. You can check the turnaround time, the compliance with your set turnaround time, delayed reports, how many delayed reports you're having, how many complaints were successfully resolved. You can track performance. So these are some of the ways you can use to improve so that the customers will be properly satisfied. You can also do internal audits, identify factors affecting patient and physician satisfaction, e.g. critical result notification, availability of requested tests, pre-analytical errors like hemolysis, etc. So how many hemolyzed samples were received this month? Next month, does it drop? So you monitor it objectively. The management reviews. The senior staff analyze feedback and implement necessary improvements. You can also do satisfaction surveys where you offer direct insights from customers on service quality. Link. You can get these surveys. You can do it by paper, you can do it electronically. Maybe the emails, when you notify them of their results, you can put a link on the email to where they can give you satisfaction surveys. You see it with some of the banks. You do something, even with DSTV, you make payments and then they survey. So you can do such surveys and then know how to improve. You can also do interviews and focus groups, allow for in-depth discussion of laboratory services. And this one is, I think, one of the ways it can be done when pathologists attend clinical meetings. Maybe you go to departments like internal medicine, pediatrics, family medicine. When you go there, you will get more complaints than even the use of selection box in the lab. When you go there, they will complaints. As they are making those complaints, be noting them. You don't just laugh it off. No, note them. Then a combination of all these tools provides a complete picture of customer satisfaction. So how do we address customer complaints and quality indicators? Handling customer complaints. Complaints provide critical insights, but may represent only a small fraction of issues. We say that complaints that you receive is just a tip of the iceberg. So majority of the complaints, you don't get there. But anyone you get, you must deal with it. Every complaint should be investigated thoroughly, followed by corrective actions. Use quality indicators to objectively monitor and improve customer satisfaction. Indicators like timeliness, errors, patient refusals, report delays. Monitoring these metrics helps the lab identify trends and then take preventive actions. Internal audits assess turnaround times, a major concern for physicians. Findings should be carefully reviewed by management and addressed with improvement plans. Every complaint must be investigated, documented, and resolved. The lack of complaint does not mean customers are satisfied. Many people do not report issues. That is why you go forward with quality indicators to provide objective data on laboratory performance. Okay, how do you manage complaints and feedback? What you do, the feedback you get, you categorize it into 3 categories: positive feedback, constructive feedback, and complaints. When you receive positive feedback, for instance, a physician comments the lab that you are doing your HbA1c results within 24 hours. When you hear such commendation, you don't keep it private. You acknowledge and share with the quality team. Because when you share such good news, it boosts the morale of the quality team and highlights what they are doing well so that they can do it better. Then the next category, constructive feedback. For instance, a doctor tells you that the results they are getting, they are accurate, quite all right, but they want it to be easier to read, especially maybe for a particular test. So when you get that, you are giving them accurate results, they are okay with your results, but the format of your result sheet is cumbersome. So what this should propel you to do is to take it as an opportunity to review the layout or highlight key values more clearly in future reports. Then complaints. When a patient complains about, for instance, long wait time for sample collection or encounter with a rude staff, you have to handle it formally and professionally. So how do you handle complaints effectively? The first thing is to acknowledge the complaint. Thank the complainants and let them know their concern is being taken seriously. So you investigate, you gather the facts, who was involved, what process failed, was it an isolated incident, when did it occur? You might use your duty roster, CCTV if you have, LIS timestamps to verify what actually happened. Then you resolve it. Provide a clear, respectful response and take corrective actions. If poor staff behavior is confirmed, then you consider retraining. Then you follow up. The person that made a complaint, you have to reach back, get back to the customer to explain what was done. The customer is so impressed when you made a complaint and you took time to address it and you tell the customer what you have done. What that does, that it helps to build stronger relationship with the customers. Okay, answer this question. A physician complains that laboratory test reports are frequently incomplete lacking sufficient information to support timely clinical decisions. According to the ISO 15189 on user communication, reporting of results, and laboratory clinical interface, what is the most appropriate and compliant action for the lab? A, ask the physician to contact the laboratory for clarification each time the incomplete information is encountered. Ensure that all laboratory results include complete structured information such as reference intervals, units, lab values where applicable, and interpretive comments where clinically relevant. Limit reports to numerical test results only to avoid overloading clinicians with unnecessary details. Reduce the frequency of reporting to ensure physicians are not overwhelmed with too many test results. Okay. I'm looking at, yes, okay. Yes. The correct answer is B, yes. Proactive quality improvement. That's the correct answer. Proactive quality improvement in response to user feedback, commitment to clinically meaningful reporting, not just data transmission, complying with IF 159 requirement to ensure reports facilitate decision making. Okay, customer surveys and feedback methods. Why conduct surveys? Helps the laboratory actively gather feedback beyond complaints, addresses specific concerns not covered by internal processes, required by ISO 1519 for quality management. Methods for collecting feedback: surveys, paper-based or electronic structured questionnaire for clients, interviews, one-on-one discussion with structured and open-ended questions, focus groups. So surveys, it can be done electronically. The one I said, you can be on a link, the link on email. It can be interview. It can be focus groups. It can be when you attend clinical meetings and then you get feedback from them. Best practices for conducting surveys and focus groups. Survey best practices. What you do, choose appropriate clients. So do you want to survey the healthcare providers? You want to survey patients? You want to survey the laboratory staff? Pre-test questionnaire for clarity and neutrality. Analyze results promptly and share key findings. Yes. The tips: prepare consistent questions for all participants. Include open-ended questions to encourage feedback. Ask, how can the laboratory improve its services? Focus group considerations. It can be 8 to 10 participants with diverse background. Build trust before discussing key topics. Use a structured focus group guide for consistency. Summarize responses in a written report for improvement. Okay, measuring customer satisfaction and continuous improvement. Various methods such as surveys, we have seen them, quality indicators, audits. They help gather useful data. Why is this important? It identifies opportunities for improvement. Data collected helps pinpoint areas needing change. Then it should lead to corrective and preventive actions to enhance customer service. Information gathering should drive change. It's not just enough to collect feedback. What are you doing with the feedback you are collecting? A well-structured customer satisfaction measurement system ensures continuous progress. Implementing changes based on feedback strengthens laboratory performance and customer trust. Okay, the ISO 15189-2022 document 5.33 clause 5.33 is about the advisory activities of the lab to the laboratory customers. So the communication of the laboratory customers. This clause focuses on the advisory role and communication with laboratory customers. Laboratory management shall ensure that appropriate laboratory advice and interpretation are available and meet the needs of patients and users. So what you do, you advise on choice. Some of the things you can do, advise on choice and use of examinations, including sample type, clinical indications, test limitations, and test frequency. For instance, a clinician sends a patient to the lab because he's suspecting Cushing's syndrome, and he wants to do a random cortisol assay. But the chemical pathologist can now advise that a 24-hour urinary free cortisol is better instead of random cortisol because of the variability of cortisol. The physician may not know this, so it's the lab responsibility to advise the clinicians. A lab user queries the appropriate sample for electrolyte analysis. Maybe the lab, they want to do electrolyte urea creatinine with plain bottle. You now advise them that it's better to use lithium heparin. You don't want to use serum. A doctor, they can be, maybe somebody is having DM, they want to monitor the glycemic control. They now request HbA1c every week or every 2 weeks. Anytime the patient is coming, they say do HbA1c. So the lab has the responsibility to recommend less frequent monitoring based on the half-life of the red blood cells. So these are some of the advisory activities the lab performs to our customers. You can also provide professional judgments on the interpretation of results. Maybe a physician does a liver function test and he sees the alkaline phosphatase parameter in a young adult is elevated, and he begins to suspect, is it a bone-related problem? So you now advise, know that ALP elevation in a young adult is not pathological. So these are the things which this ISO clause advocates that the lab should do for the healthcare providers. They also promote effective utilization of laboratory examinations. The lab, for instance, the lab develops and distributes guidelines on rational test ordering, because there are some that duplicate, they will order ESR, other C-reactive protein. So it's the lab responsibility to say, no, they do the same thing, so choose one. And preferably, we advise that you choose C-reactive protein. So these advisory activities is one of the key recommendations from this document. Okay, so answer this last question. Despite operating a well-equipped laboratory with modern analyzers and validated procedures, physicians and patients consistently provide negative feedback regarding unclear test instructions and lack of interpretations on lab results. In alignment with ISO 15189 requirements on customer service, communication, user satisfaction, and continual improvement, what key action should the laboratory prioritize to improve satisfaction and service quality? Ignore feedback, since equipment, quality, analytical accuracy are the primary indicators of laboratory excellence. Establish structured communication protocols. Okay, the answers are already coming. Maybe I'll just continue. Okay. Strategies to improve patient and health provider interactions. So what the lab needs to do, there should be patient-centered care, empathy, and active listening. The laboratory staff should make patients feel heard and valued. Techniques such as paraphrasing concerns and showing empathy through tone, clear communication of test procedures and expected timelines, ensuring patients understand why a test is being done, how it will be performed, and when results will be available. The patient is informed in advance that their fasting lipid profile requires an 8-hour fast, reducing errors from non-compliance. Clinical collaboration, regular updates on tests, on new tests and lab capabilities, organizing periodic clinical meetings to update doctors on new test offerings, providing interpretive comments on complex test results. Many clinicians are not laboratory specialists. Adding interpretative comments helps them make informed decisions. The impact of critical value notification, ensuring clinicians are promptly informed of life-threatening results. Training and development, empowering laboratory staff with soft skills and professional development opportunities, ensures better interaction with patients and clinicians. Role-playing and communication skills, workshops to ensure You can do workshops so that the lab workers know how to conduct themselves when maybe they get agitated patients, how they need to be calm and cooperative. You conduct workshops on how to de-escalate when the atmosphere is tense. How do they de-escalate? They have to replay it so that it becomes part of their daily practice. Then continuous professional development in customer service. What do you discuss? You can integrate emotional intelligence in healthcare, integrating customer service training into laboratory staff orientation programs. So orientation should not just be for new staff. It's not just about taking them around the lab. No, you should also train them on how they can satisfy the customer. Encouraging participation in online courses. So they don't need to, it's not even, you don't need to leave the lab, go for the some of this can be picked from attending online courses as you are doing now. Webinars or professional conferences focused on patient engagement and communication in healthcare. Then we'll just quickly use this slide to look at digital reporting and turnaround time optimization, how you can use technology to reduce the turnaround time. So if you look at this, you see this is a sample entering the lab, is barcoded, then it comes here. The sample is scheduled and properly tracked, is processed. So there might be a connection with the equipment. And then when it is done, the results are properly quality controlled. The results that are available, then they are now sent to the electronic health record system. You know, there are some institutions that have just electronic health record system, standalone. They don't have laboratory information management system. And there are some that have laboratory information management system. They don't have electronic health record system. So if you now look at the right, the study shows that when there is an integration between electronic health records, that means when they have this electronic health records system and is integrated with the laboratory management information system, it does a whole lot of good to the institution. So it is, that's what the study did. It tried to, the objective was to determine the impact of interface integrate this. It reduces the turnaround time, and there are other benefits. It improves the accuracy. The number of errors reduced, increases the speed, is easily accessible to the physicians, to the lab workers. It reduces delay, and it just does a whole lot of good. Okay, so we'll now go to this one that in previous presentations we've been asking, how can we engage the stakeholders in the lab? So there are stakeholders, all these ones we've discussed, they are all stakeholders in the lab, but we've discussed the patients, the clinicians, the regulatory bodies. So we are just going to concern ourselves with the hospital management and top management. In the ISO 15189 framework, stakeholder engagement is not just good practice, it's a requirement. Think of stakeholders as everyone who influences or is influenced by the lab's work. That includes the hospital management. They are the ones that prepare budgets for the lab. They provide the resources. Maintaining quality is expensive. And if the top management doesn't buy into your quality objectives, it will not succeed. Engagement means involving them in quality discussions and helping them see how the lab's goals align with broader institutional goals like patient safety, cost effectiveness, and the institution's reputation. Quality is not just a lab-only affair, it's everyone's business. So how can you win top management support? What you need to do, align your quality goals with institutional priorities. There are some institutions, so they want to get accreditation, Then try to tailor your quality goals with the accreditation. There are some things the hospital will never spend money on, but if it's accreditation, you'll bring out money. So all those, that's why you have to plan to know the things you need, so that once the opportunity comes, say you want to do accreditation, you say, oh, this accreditation you want to do, this thing needs to be there because this accreditation body, they need this thing to be there. Then they can bring money and then you do that. Try to show them, link your quality outcomes to patient satisfaction, cost savings. Show them how these quality objectives can help to save cost. Because they complain there's no money, there's no money. When you tell them this thing can save cost, then they'll buy into it. Then speak their language. Use data. That's why you need to just, you have a laptop, you can use Excel and do a whole lot of things. You can show them how the error was reduced between last month and this month. Show them how the turnaround was improved. When they are seeing these figures, they are seeing the one, the bar that is blue, the one that is green, they see how the thing is reducing and they are seeing it. They buy and even attract more patients. Use short reports and real success stories. Top management often responds to numbers and impact. And don't underestimate relationship building. I think building relationship is the most important thing to do in engaging top management in lab quality affairs. It must not be the MD, as I said earlier on. Work with everyone that has your ears. Anyone that has your ears, just work with him. It could be the CMAC, HPS, or any other person. And you have to be patient. If it doesn't work out with the current MD, it can work out when he's gone. They can work with the next MD. So you just have to keep at it. You don't give up. You keep engaging anyone that has one day. As you keep telling them, maybe you might go to another facility and they hear similar something, and then they come back and say, oh, what were you saying the other time? And then you've converted them. So you just have to keep at it, engaging top management. So what are the challenges you may face? What are the challenges you may face when you want to enhance customer satisfaction, communicate effectively, and engage the stakeholders? There are challenges you are going to face, but they are all surmountable. The first, there might be resistance to change, because this is one of the most common hurdles, especially when staff or management have become used to the way things have always been. They are doing their work, they are getting paid, and then you now want to bring extra responsibility on them. You say, I beg. So that's initial resistance to change. They might try to, you want to implement new documentation system, you want to introduce non-conformity tracking. Some may see it as unnecessary burden. Is it going to add extra money to my salary? It doesn't. So you don't want to. These are some of the challenges you may face. And how do you overcome such challenges? You can overcome them through advocacy, awareness campaign. Tell them what is in for them, what they can benefit. It's good reputation if you are working in a lab that has so and so, have this accreditation is good. When people will prefer your lab results to another because of your quality credentials. So you keep at it, advocate, create awareness, and then you do short sessions to explain the why behind the changes, the things you want to do. You can organize small sessions to show them the why behind it so that they see the reason behind what you are doing and why they need to key into it. Another challenge you may face is lack of awareness about laboratory processes. Many stakeholders, especially those outside the lab, like the hospital administrators, they don't fully understand what we do or the complexity of our processes. So these are some of the challenges. It can lead to unrealistic expectations or miscommunication. It's difficult, they are communicating, but they are not getting you because they don't understand the processes that goes on in the lab. What do? You organize brief orientations for them. When you go for their meetings, you can just do 10 to 15-minute presentations at the department, at the different departments, internal medicine, family medicine, pediatrics. Just show them. You can even at management meetings, just 10 to 15-minute presentations to show them the importance of what you are doing and how the thing is a plus to the institution. And that challenge is communication breakdowns. Example, let's say a department raises concern about turnaround time, but hears nothing. That's another challenge to satisfying customers. They make a complaint and you didn't attend to it. Next time, they may not complain to you. They'll just bypass the lab or they might escalate it. So what do you do when such things arise? What you do, you can leverage technology. You can form a WhatsApp group where you have some HODs, even the MD can be in that WhatsApp group, so that any complaints, when there's any complaint about the lab, it can be posted there and attended to. You know, somebody might just come and meet one person in the lab and the person doesn't give the information and just takes it and starts to spread, talk ill about the lab. So when all of you, the stakeholders, both the management, some HODs in the hospital, the lab quality team, you are in one WhatsApp group. Any complaint concerning any aspect of the lab, whether in chemistry or hematology, it can be put there. Once you put it there, then it's quickly escalated. You find the person that needs to address it. So when you have all these people in one forum, in one group, then it is very easy to address their complaints. And then it helps to build trust. So these are the things you can do to solve and attend to these challenges. Okay. So in conclusion, effective communication fosters trust, while stakeholder engagement ensures continuous quality improvement and compliance with international standards. By integrating digital reporting systems, standardized processes, and prioritizing feedback, laboratories can build a culture of excellence. The final words, customer delight is the heartbeat of quality management, driving excellence through every interaction. Thank you. So please, we can take the questions now. Back to you.
Hello, thank you very much for that very clear presentation. I would like to urge those who are talking at the background to turn on, to mute their systems. Thank you very much. Thank you very much, Dr. Izuchukwu, for the presentation. The floor will be open for any questions or observations. If there's something anybody would want to chip in from the participants, we'll be willing to take that right now. Thank you very much. We're open for questions, comments, observations. Is there any in the chat box? Okay. Loretta Ethafo says, "Thank you very much, sir, for your presentation. It was clear and practical." Thank you very much for that feedback. Do we have any questions or any other observations? All right, so in the absence of any questions or observations, once again, thank you, Dr. Izuchukwu, for today's presentation. It was very straightforward, and in fact, personally, I don't think I even have any questions because you did justice to everything, and even your approach to stimulating our thought while making the presentation by drawing us to questions which we should respond to was very, very useful. in making the presentation very engaging. Next week, we'll be having another presentation in our webinar series, and the topic for next week will be occurrence management and non-conformance handling in laboratories. In this discussion, we'll be looking at the best practices for incident reporting, documentation, and root cause identification. We will look at how to use data analytics to identify trends, monitor them, and prevent error. And then the third objective would be implementing corrective actions to mitigate laboratory non-conformities. Dr. Mike Mbata BK would be anchoring that presentation. She had been with us the last time, I think, on sample. So let me look at the chat group again. Okay, we don't have any question. Onishi Lillian says the presentation was very clear and engaging. Thank you very much. Thank you very much, sir. All right, thank you very much, Lillian, for that feedback. Join us next week by 4 p.m. as we carry on with our weekly webinar series on quality management. Until then, have a blessed day. Bye, everybody.